Whether it's volunteers, medical workers, patients, or people living in isolation, the COVID-19 outbreak can take a toll on more than just physical well-being. It can also impact mental health. Joining me now to talk more about that is Dr. Rosen Spector. She's a psychologist focused on trauma and recovery. She joins us now from Philadelphia. So, Dr. Spector, let's take a look at the toll on doctors, nurses, other medical workers. How can they get help when they're so busy saving other people's lives? Who helps them?
Well, that's a very important question, because anybody who's a first responder or taking care of people who are ill or sick has to worry about self-care. So at some point they're going to have burnout. So they're going to need to either have community groups or get professional help so that they don't get overcome with the feelings that they compartmentalize to help take care of people.
What's the best way, if there is a best way, to ease stress during this massive outbreak?
The best way is to make sure that the people who are volunteering get to meet with other people who are volunteers and to be able to talk about how scared they were, how worried they are about contagion, about their own survival, and to help build each other up so they can go back in and help with the trauma.
And what about all those people under quarantine, officially or unofficially, and anyone basically stuck inside for days on end? Any advice for them?
Well, hopefully that they will have some way to communicate with others. Otherwise, everybody is isolated in their own little pod. So whether they do it through the internet or they do it through cell phones, some way to talk about their feelings with other people who are similarly stuck.
And sometimes folks can get very busy. What are some signs that people can look out for in other people? How can you help others who may be hurting or in trouble?
I think that, all you can do is see when somebody needs a hug, if you're allowed to do that in a contagion zone, or to say, do you need to talk? Do you need a cup of tea? Here, take a little break. I think part of it is to realize that people just run out of gas.
And Dr. Spector, as you've watched the coronavirus, COVID-19 unfold over the past several weeks, what would you say comes to mind? What is your biggest concern when it comes to mental health here?
I think that people are very anxious, including people who don't have a reason to be anxious. When you have a lot of news reports that there's a pandemic coming, people get very nervous when they, in fact, have no cause to really be infected. So people have to use some common sense and to look at what's really going on and not just allow their anxiety to overwhelm themselves.
All right, some good advice there, Dr. Rosen Spector. Thank you so much for joining us from Philadelphia.